Hi, I'm Dr. Bob Yetto of the Department of Restorative Dentistry at the University of Buffalo School of Dental Medicine. I'd like to discuss with you diode lasers, an essential tool because beauty is in the details. The diode laser is a portable instrument that can be used as a replacement for scalpel or electrosurge. Because the diode laser is so precise and has such little collateral damage, it's an excellent choice for aesthetic purposes. Such precise work can often be accomplished without need of anesthesia and with little or no bleeding or discomfort. When used for most cutting procedures, the silicon fiber optic cable is initiated for contact delivery. Initiation concentrates the light energy to the tip of the delivery fiber. Initiation is performed by touching the fiber to a dark surface, such as articulating paper, while activating the laser energy. For the list of indications, those in purple require an initiated tip. Those in orange require a non-initiated tip, one which will allow the laser energy to penetrate deeper into the tissues. The laser-assisted new attachment procedure, or LANAP, is a periodontal regeneration technique that can also be performed around failing implants. By using the diode laser to perform cellular debridement, clinical indices of periodontal health may improve. Once the pocket has been probed to depth, the laser is used to eliminate tissues to the reticular layer of the epithelium. Scaling is then performed to eliminate calculus, and the laser is reintroduced in a non-initiated way in order to sterilize the pocket. The tissue is then approximated to the root surface and occlusal adjustment is performed. This can allow the tissue to heal at a level higher than that predicted by the level of bone. The gingival architecture depicted in B is considered ideal, while A is considered acceptable. The architecture depicted in C, where the lateral incisor height is greater than that of the centrals or cuspids, should be avoided. Axial inclination of the tooth root accounts for the zenith position of the gingiva. Although there are several tooth width proportion theories, golden proportion is that which is best known by both dentists and laypersons. In this example showing a 78% width to height ratio, on the left, the lengthening of incisal edge position is a biomechanical issue. You may not be able to do this based on occlusion. However, on the right, the gingival height position is a biologic one. That can be altered by crown lengthening with or without osseous recontouring, depending on the needs of each individual case. In order to maximize the aesthetics of anterior bridge work, ovate pontic sites are developed using a diode laser, tissue molding procedures, and support of a properly contoured provisional. This will result in a pontic that appears to be emerging from within tissue rather than sitting forward of tissue. This patient will lose both central incisors due to periodontal disease. Supporting the tissue and creating an ovate pontic site is imperative. while in provisional restoration it was noted that the gingival height above tooth number 8 was lower than that of tooth number 9. The diode laser was used to recontour the tissue during the patient's visit, checking on the provisional. This was done without anesthesia and did not cause any bleeding. The precise nature of cut, with minimal collateral damage, allows healing to be precisely at the level at which the tissue is left. When the provisional is removed, epithelialization is further advanced in the area of tooth number 8 than tooth number 9. The final prosthesis shows properly contoured tissue supported by the ovate pontics. Again, gingivoplasty is performed with an initiated fiber. You must always be aware of biologic width. The connective tissue and epithelial attachment components are constant, whereas the sulcular depth can vary. The distal portion of marginal gingiva on tooth number 9 has just been removed with the diode laser. Note, there is no bleeding. Since the fiber seeks darkness, marking the tissue appropriately with a Sharpie can aid in visualization of the sculpting procedures. Because the diode laser gingivoplasty is accomplished with little or no bleeding, results can be seen immediately. In this example, 9 mesial required some additional recontouring. The Class 4 restoration and the inclination of the teeth could not be improved without the use of the diode laser. Removing some tissue at 9 mesial allowed the inclination to be corrected while the teeth were repaired. This orthognathic case refused surgery, but was helped by the use of the diode laser and porcelain veneering. The tissue is sculpted and results in a beautiful improvement, even though no bone was altered.